Imagine that one day, you start noticing the world around you isn't as clear or colorful as it used to be. Everything seems a little dull. Road signs look blurry, bright sunlight stings your eyes, and the vivid colors you remember seem washed out. It can be frustrating, confusing, and even a little scary. This gradual change in vision is a common experience for millions of people, and for many, it can be linked to a condition called nuclear sclerosis. Section 1. What is nuclear sclerosis? Nuclear sclerosis sounds complex, but at its core, it's simply the natural process where the lens of the eye, the transparent part that helps us focus, starts to cloud, harden, and turn yellow. This process happens slowly, often without people noticing it right away. It's a form of aging, much like getting gray hair or wrinkles. And although it's normal, nuclear sclerosis can lead to vision changes that might affect your daily life. Here's how it works. Our eye lenses are made up of proteins and water. As we age, the proteins begin to clump together. Imagine it like looking through a clear glass that gradually becomes hazy and thick. This clumping process in the lens makes it tougher for light to pass through and reach the back of the eye, affecting how well we can see. Section 2. How does nuclear sclerosis impact your vision? You might be wondering, what does this actually mean for me? Since nuclear sclerosis often develops slowly, the symptoms can sneak up over time. Some of the first signs include subtle changes like needing stronger light to read, noticing a slight haze, or finding it tough to tell colors apart, especially in low lighting. For some people, these symptoms remain mild for years. Glasses can often correct the vision changes that nuclear sclerosis brings, allowing you to manage daily tasks without much trouble. But as it progresses, vision problems might become more pronounced, such as blurry or dulled vision, particularly when trying to read small print or see fine details. Difficulty seeing at night, especially when driving. Bright headlights can feel like they're blinding. Colors can look faded, like looking through a yellow or brown filter. Tasks that once felt routine, like seeing road signs or even recognizing faces from a distance, might require more effort. Section 3. What causes nuclear sclerosis? Now, why does this happen? Why do some people seem to experience it earlier or more severely than others? While nuclear sclerosis is largely age-related, some factors can make it more likely to occur. Family history, genetics can play a role, so if your parents or grandparents had issues with cataracts, you might be more prone to them. Smoking, tobacco use increases your risk. Just like smoking can damage the lungs and skin, it can also harm the eyes. Obesity, being overweight puts more strain on many parts of your body, including your eyes. Myopia, if you're nearsighted, you might also be at higher risk of developing nuclear sclerosis. Diabetes, this condition is known to affect blood vessels and proteins, which can speed up nuclear sclerosis. Exposure to UV light, regular exposure to sunlight or tanning beds without proper eye protection can increase your risk. Section 4. Nuclear sclerosis versus nuclear sclerotic cataracts. At this point, you might have heard two terms used interchangeably, nuclear sclerosis and nuclear sclerotic cataracts. Are they the same thing? Not quite. Nuclear sclerosis is the process of your lens thickening and yellowing over time. When this process progresses further, the lens can become so opaque that it's considered a nuclear sclerotic cataract. Think of it as a scale from 1 to 4, with nuclear sclerosis at the early end, progressing through the stages of a nuclear sclerotic cataract. When it reaches grade 4, vision is typically very impaired, and cataract surgery is often necessary to restore clarity. Section 5. Diagnosing nuclear sclerosis. If you're experiencing any of the symptoms, an eye exam is the best way to find out if nuclear sclerosis is the cause. A few simple tests can reveal a lot. Slit lamp exam. This test uses a microscope with a bright light, allowing your doctor to closely examine your eye lens and detect early signs of nuclear sclerosis. Dilated eye exam. Eye drops will widen your pupils, giving your doctor a clear view into your eye and helping them see any changes in the lens. Red reflex test. In this test, light is bounced off your eye's surface. A doctor examines the reflection to spot potential changes. These exams are painless and quick, giving you peace of mind by either ruling out or diagnosing nuclear sclerosis. Section 6. Treatment and management options. The good news? For many people with mild nuclear sclerosis, treatment isn't needed right away. Glasses can often correct vision issues caused by this condition, especially in the early stages. But as nuclear sclerosis progresses, glasses may become less effective, and that's when cataract surgery becomes an option. Cataract surgery is a common, straightforward procedure. A surgeon removes the cloudy lens and replaces it with a new, artificial one. This artificial lens doesn't cloud over time, so it's a permanent fix. For those struggling with daily activities due to vision impairment, this surgery can be a life-changing solution. Section 7. Tips for living with nuclear sclerosis. While surgery is the ultimate solution for severe cases, many strategies can help you manage the condition in your daily life before surgery is necessary. Avoid night driving. Headlights can feel like they were magnified when you have nuclear sclerosis, making night driving more challenging. Use bright lights when reading or doing close-up work. Stronger lighting can make a big difference. Wear anti-glare sunglasses. These reduce the impact of bright sunlight, making outdoor activities more comfortable. Regular eye exams. Keep up with eye exams to ensure your glasses prescription is always up to date. Section 8. Slowing down nuclear sclerosis. While nuclear sclerosis itself can't be stopped, some lifestyle changes may help slow its progression. Protect your eyes from UV rays. Wear sunglasses that block UV light whenever you're outside. Quit smoking. Quitting smoking doesn't just improve your lung health, it's also good for your eyes. Eat well and exercise. A balanced diet and regular exercise can keep you healthy overall, which also benefits your eyes. Conclusion. Nuclear sclerosis is a normal part of aging, and for many, it's nothing to fear. By being aware of the symptoms, understanding the causes, and taking proactive steps, you can maintain a clear vision and a good quality of life as you age. If nuclear sclerosis progresses to the point that glasses no longer help, cataract surgery is a safe and effective solution. So, if you or a loved one are experiencing changes in your vision, know that there are plenty of ways to manage this condition and keep your world in focus. Remember, taking care of your eyes today helps protect your vision for tomorrow. If you have any concerns or experience symptoms, schedule a visit with an eye care professional. They'll be there to guide you every step of the way.